Hello, my name is Shayla Gray, and I'm a licensed marriage and family therapist in Virginia and a licensed clinical marriage and family therapist in Maryland. I'm also owner of Serenity First Counseling, and we help provide therapy to individuals and couples. And I am here today with Renee. We are offering this conversation just as an opportunity for individuals to get to know a little bit more about us and how we're able to be a resource to the community. So excited to be here with you today, Renee. How are you?
Same. Hi, everyone. I'm Renee Costick Reynolds. I am part of Collin Family Mediation Group, which is a practice here in Northern Virginia. And we have been in business since 2017. And primarily, we help parties who are going through a separation and a divorce, those parties that need parenting plans. We assist you throughout the entire process from the beginning of the process through your final memorandum of understanding, which is the document that you will use to file your final divorce. And we also work with other specialists such as Shayla throughout the process to help parties assist them with other aspects as they're going through the divorce process.
Nice, nice, nice. So oftentimes, Renee, I can imagine that you may have clients ask, what is the difference between therapy and mediation? Right?
Yes.
So what would you say from a mediation standpoint? What is mediation? Can you talk about it?
Well, our primary goal of mediation, of course, is to come to a concrete, practical resolution for the parties. So it's really the decisions that need to be made for them and how we are going to make them so that we have a final resolution on paper of what needs to be divided in the process of parents and families that are divorcing. So our focus is really very future oriented, and what that financial and emotional and parenting future will look like.
Mm-hmm. Yeah, and I appreciate you for just, explaining that a little bit because from a therapy kind of standpoint, what therapy is really, or the difference in that is that therapy really kind of entails going through a process where each individual's journey can be a little bit different, right? And there can be barriers along that journey, right? And so where I'm hearing in mediation, there's kind of a goal or a place that individuals want to get to. And sometimes with therapy, there can be this stuck point, and therapy can help kind of get those blocks or help get unstuck, or get
Absolutely.
you unstuck in some.
Right. Absolutely. We have many clients that come at different stages because there's two people in the room, and many times one party is at a different stage than the other party. And it's very difficult to move forward with the decision-making process if they are emotionally stuck or if they're having a hard time moving forward
Mhm.
and wanting to discuss the trauma of the relationship,
Mhm.
or the things that happened that brought them to the point that they are at meeting with me. So
Mhm.
I, as a mediator, am more focused on the process of moving forward and trying to get the parties to think about their future as opposed to doing the work that needs to be done with you as a therapist in order to get them to that place.
Right, right, right. And that kind of really went into my next question, which is how can how could therapy and mediation work together? And really, it's like you mentioned, right? When you have this goal, sometimes there are barriers that stand in the way of getting to that goal. And so, what therapy could do is support individuals in getting through those challenges to help them get closer to those goals.
Absolutely. I think it makes a world of difference when parties are engaged in both at the same time because you, as the therapist and the mental health professional, can deal with their emotional and relationship that they're involved with and
Right.
trying to discuss and move past those emotional issues.
Right.
And in mediation, we're more focused on the practical
Right.
decisions. And of course, emotion plays into the room,
Mhm.
and we do need to manage that, but it is much more manageable if people are aware of what triggers them and we're all in a room together, right? So I've got both parties in the room, and they have a past with each other.
Mhm.
So
Mhm.
being able to really help them resolve sustainable and create sustainable agreements
Mhm.
much easier when they have that emotional support
Right.
therapist.
Right, right, exactly, exactly. So I'm wondering, right, as we're talking about this, is there an ideal time for families to engage in both therapy and mediation? And if that were to happen, right, how could you and I work together in a situation like that?
I think I think there's maybe three layers to this. I think maybe beginning therapy prior to beginning mediation, if you've got the situation where emotions are really running very high.
Hmm.
And like I mentioned, if there's one party that is not ready yet to engage in the mediation process, being able to meet with a therapist first
Hmm.
and being able to work through some of the emotional issues that are going to come up once they're in that room
Hmm.
with the other party trying to make decisions. I think it's ideal to meet with a therapist first.
Hmm.
I think that it is easier to move forward in the decision-making process, and
Hmm.
we can do it concurrently if parties are able to focus on the concrete issues.
Hmm. Hmm.
Um, and I mean, simultaneous engagement, I think, is the best place to be.
Right,
So we
right.
can engage at the same time. And so parties can be visiting with you and talking about what's happening in the mediation.
Hmm.
And then they can meet with me and be able to actually have those conversations,
Right, right.
move them forward.
Yeah, and I think that makes sense, right? And similar to what you mentioned, right? What that could look like is meeting with me first, having that discussion around, what are the goals, right? Because I think from both a therapy standpoint and a mediation standpoint, a wraparound approach would be helpful, right? To where yes, there may be slightly different goals, but the ultimate goal is the same in terms of getting them moving forward. And so really figuring out how we support them together so that we're both operating on the same page there.
Right.
And I think that's really where that work, that collaboration together, that focus is important.
Right. And I'm glad you mentioned the collaboration piece of this because I do think that being able to work with both of us as professionals and if needed, being able to talk with each other, you and I, having our clients, I know it's a confidential process in both, but if they are willing to share that and allow us to collaborate with each other, that
Mhm.
also is an extra support
Mhm.
for the client,
Mhm.
knowing that we we are both knowledgeable about what is happening with them and
Right,
what they're able to, what may be hard for them,
right.
either when they're in my meeting or when they're, meeting with you.
Mm-hmm. Mm-hmm. Yeah, yeah, exactly. Exactly. And so, I think you know, as we're having this discussion, so many possibilities, right, of what this could look like for individuals looking for support, whether it be therapy that they are looking for or mediation that they are looking for, and knowing, kind of what the difference in both is, right? Therapy is an approach where if you need support diving into past issues, present issues, future issues, or if you're looking for mediation where it is more kind of goal specific that involves another person, we're here to support. And ultimately, that is what we want you to know. Is there anything else, Renee, that you think it's important for folks to know about what we do?
Well, I think for purposes of, mediation, and I want to just make that distinction that as mediators, we are neutral parties.
Mm,
So our duty is to work with both parties and not take one side or the other side. It is really being able to move the parties forward to a resolution that they both think is fair and
right,
equitable.
right.
And so I do a lot of reality testing in my sessions. If people are trying to make decisions, what will that decision look like in 6 months, in
Hmm.
a year, in 2 years?
Right,
And, you are more focused as a therapist dealing with individuals.
right,
So I just want to be clear about that distinction that that we are is supporting both parties, and I'm trying to do that very neutrally. And so both parties need to go see different people, of course. That
right.
is something that we would promote and give them the information. But both parties are getting that information, not just one party.
Right, right. And I also, I just as we're talking about this, Renee, I also just wanted to also share that, in therapy as well, there are times where, couples may decide that they want to do therapy, which is also, perfectly fine, but I think the difference, as you were sharing, the difference there is in the therapy setting with couples, the issues are what we are focusing on, right? It's a clinical setting with the couples therapy. And that's a bit different from
Huh.
the mediation space. And so I think it is important that you mentioned those differences there because, I think it can be confusing, but ultimately, the reason why we're putting this resource out is just to make sure that individuals know that there is a difference there.
Now, I do have a question for you because I do have clients that come to me that maybe have started as couples therapy and they're working through things, and then they kind of um, realize that that might not be something that their relationship might not be sustainable, and they move to discernment
Mm.
therapy. Do you do any type of discernment therapy, or what that means? You probably have much more knowledge than I do.
Yeah, yeah. So I think it would honestly depend. I know as a part of the couples therapy process, as a therapist, I am always checking in on the goal, right? So now I may have couples that come in and they may have a goal to remain in the relationship. However, as time progresses, they may decide that that is no longer the goal. The goal may be separation and co-parenting. And if that is the goal and they're able to continue to remain dedicated to figuring that out and the goal shifts, then that is something that we can continue to work on. However, the most important piece to that is that both parties have to be willing to continue to participate in the therapeutic process. And so
Right. Right.
that's the difference there. And sometimes that doesn't always happen.
Okay. Okay.
Mhm.
Um, so I guess for you, what does a successful outcome maybe look like when parties are going through this process?
Yeah, yeah. So for me, it is really the client being able to say that they have gained something from this process, right? I share with many of my clients during the intake session is that this process isn't about me. It is about them, right? My goal and my position in each of my therapy sessions is to support the client. And so for me, success is really measured by what the client is able to take away from the therapy process, right? If they are able to take away tools that are able to better themselves or their relationship, then I am deeming that as a success. If they are able to get closer to a goal that they, have set for themselves or for the process, then I am deeming that as a success. I am measuring the success of the space based off of what the client has listed as success.
Okay. Okay, that makes sense.
Yeah.
I think for me, if I can get parties to um, de-escalate the
Mm,
tension in the room, find better communication skills with each other,
yeah,
come up with a concrete agreement that has been, it's self-determination is a big part of mediation, that people are making their own decisions without the influence of a judge making that decision for them,
yeah, yeah,
being able to say what is best for their family.
right, right,
And, if there's children involved, really prioritizing what's
right,
best for their children. Because
right,
I always tell parents that they will continue to be a family. Their family will look very different, possibly,
right,
but it doesn't mean they're not still a family.
exactly.
And be able to come out the other side still intact in the most important ways is important through for me, a successful agreement for
Right,
families.
right. Awesome, awesome. So, Renee, if folks were trying to reach you and trying to learn a little bit more about the services that you all offer, how would they do so?
Well, our website is colinfamilymediationgroup.com.
Mhm.
And there's a contact form on there that they can certainly fill out, and that goes straight to our inbox. Also, we have many on our website. There's lots of information. So if people want to learn more about mediation, we are doing blogs. We have several blogs on there every month,
Mhm.
and we also have a LinkedIn page and a Facebook page.
Nice, nice, awesome, awesome. Great. Yes, and if you want to learn more about Serenity First Counseling, you could do that on Serenity First Counseling website as well as our Instagram and Facebook page. And we look forward to continuing to provide information to be a resource to you all. Thank you so much.
Thank you.